Should you be using the word patients, clients, or customers? This is often discussed by hearing care practitioners. And from what I've observed, the industry seems to be leaning more comfortable with the word patients. But how do we know if this is the most appropriate word to influence positive behaviors to address hearing care issues? In this video, I really want to dissect why one word might be better than the other and give you the facts to help you come to the right conclusion. So wait for the hearing aid activation jingle and we'll get started. If this is your first time coming to my channel, hi, my name is Era Abraham. I'm the person with the lived experience of hearing loss. I also have a tech startup that utilizes AI to help individuals with hearing loss become aware of environmental sounds that are calling for their immediate attention. And in all these years, I have been practicing the art of marketing to people with hearing loss. And this is the channel where I want to be able to share my learnings on marketing hearing care. So the right word is very critical when it comes to marketing because words can influence and create desired action. And the reason why we need to sort of reflect on the idea of whether the word patient, clients, or even customer is appropriate is because I strongly believe that the hearing care industry needs to factor in stigma as part of their marketing and the messaging. Because this is one particular healthcare practice alongside anything related to mental health, any industry that often involves stigma. The marketing approach is strictly different than any other industries and sectors, eye care or getting Botox or any other kind of form of um, medical practices. And so, with that, we have to be really conscious about the words that we utilize in our marketing messaging. And I believe that many people in the hearing care industry want to advance hearing care, particularly knowing that there's a benefit of having a proper treatment towards addressing hearing issues. And because we want to achieve that goal collectively, we need to be thinking about what are the barriers that might be existing. And this is the purpose of this video, is have that discussion and allow for you to reflect. Now, before I begin, if you already are sold on the idea of using the word patient and you do not want to make any thought, or you don't bring any thought to maybe changing your mind, I would appreciate that you kind of put that aside so we can really just reflect and take all the facts and see what is the best route forward collectively as an industry. So let's just go right forward and talk about what are some of the positives associated with the word patient. And one of the things that I know is the driving force of using that word patients because audiology is a medical field. It is a branch among many sectors in medicine and healthcare. And particularly if you're an audiologist, your investment towards your education, the hundreds of thousands of dollars that you put towards becoming and getting your license to practice, and then also the fact that you are dealing with an industry which has been devalued, that I can see there's a goal and desire to want to keep holding on to the word patience. But however, that can become a backfire when you don't really think about who the people that you're trying to support and help. Let's flip it around. I'm looking from the patient side. So, what are the benefits to having the word patience? Well, there's definitely a segment of customers or clients or whoever you want to call it, these people with individuals who either who have hearing loss and who obviously believe in the medical field and they are not here for hearing aids. They're here because they believe they have a hearing issue, and it's much more than just hearing aids. And that can only be addressed through this kind of medical healthcare practice. And so for them, they value the word patients more than clients or customers, and they will actually think that you're more of a hearing aid salesperson if you lean in on other terms other than using the word patient. So let's look at the negatives associated with using the word patient. When you're looking at it from the perspective of stigma and somebody who perceives hearing loss and hearing aids as stigma, and those two are different. And I can talk more in other videos. And I would say the person that often factor into both brackets wouldn't feel that patience is a negative term. It's associated with somebody who's unwell. We often hear the word cancer patients or hospital patients, and people who are particularly in the older demographic who have acquired some hearing loss do not want to be associated with the idea of getting old. And that's one of the most common reason for the stigma around hearing loss. And it's not just about how they feel about themselves, it's also how their peers and or their loved ones, their spouses or their children perceive them. And when somebody is concerned about having to address their hearing loss, there's a lot of societal messaging around hearing loss as being old. And this is actually coming from words that have studied and researched around hearing loss and stigma. And one of the things that keeps coming up is that a lot of people realize that getting old is actually the turning point of the days and numbers of their life on this planet being limited. And I don't know how to put it in a nice way, but I guess if they want to be frank, people are realizing that they're going to be dying very quickly. And if we can understand that desire of not reaching that point, there is a huge reason why people would not want to push forward to address their hearing loss. They want to deny that problem. And of course, according to a lot of the messaging and conversations around hearing care in our society, people are taking 7 years to address their hearing loss. And it would make sense. If I knew that, if I had the belief that if hearing loss was actually associated with being my end of my life, I would certainly would not want to accept that, especially when I feel perfectly physically fine. And so when we think about the word patient, there is a negative connotation in terms of those who are ill. And I can see a lot of people who are who perceive hearing loss as a stigma would not lean in favorably with the word patient seen in some of the marketing messages or the communication um, collateral that we as an industry produce. And so I really think it's very important to remember that. The other reason why we would not want to utilize the word patient, and this comes to the series of studies that have been done around positive word association. Many of our marketing tactics in our society has been directed by using certain words to disassociate ourselves from what is perceived as negative. So if we assume that patient is a negative term, then we would often want to choose other words which are more favorable. So maybe the word client and customers has a much more favorable term than somebody who perceives patient as ill. And we have always been doing this in marketing in our society. And one perfect example that came in a research that I was reading is around this whole idea of people who eat meat. Now, in our society, we often do not say that, for example, I don't go around telling people that I ate a cow today. And because people would look at me very oddly and probably disgusted by that. But in our society, we have reframed the word from eating a cow to other words like hamburger. So I went and ate a hamburger. It's probably less disgusting than any other term. So I think it's important to realize that when we choose certain words, we can associate better positive meaning to it than using words that have a negative connotation associated with it. And some of the other terms that come up, as I mentioned earlier, client and customers. But they also have their plus and negatives as well. When you think about clients, something that sounds very more professional, we often use that in the business to business world. Now, the other are the word customers, and customer has it's been used a lot in the commercial space. You know, your local grocery store considered you as a customer, and so whether that is the ideal term to use, it would certainly perceive that your business as more transactional because on those cases, often when people are interacting with that business, the purpose of interaction is to get something and leave. Um, so where does this kind of land us in this conversation? And I think it's really up to you to decide and how you want to be reflected as a profession. What is your goal and what do you hope to achieve? What kind of mark do you want to leave as you carry out this profession? And so, if that is to really help people feel more confident about their hearing care, then you obviously want to start to look at the word outside of the word patients and opt for clients instead or customers instead. If you're really wanting to justify that this is the medical industry and you feel that the people with hearing loss that come into your business should be treated as patients, then you should certainly choose that. And I think that there's ways alongside with choosing the right word, you can really bring in prospective clients by being specific about what your business is about and what your goals are and who you want to target. So that's the end. If you like this video and you want to watch more, wait for the low hearing aid battery tone for more.